Good morning, everybody. Thanks for joining us today. I am very pleased to be able to introduce our Congressman, Congressman Lawler. Congressman Lawler has some wonderful news to share with everybody today. I'm not going to steal your thunder, but he is going to talk about how he's going to make it easier for families to have children who are struggling today. Congressman Lawler has been a terrific supporter of Montefiore Nyack Hospital and healthcare generally. We know him initially as the deputy town supervisor of Orangetown, and then in the state assembly, at which time he was a vociferous advocate for Montefiore Nyack Hospital's funding that we were trying to secure, and many other things, and was a really terrific supporter of healthcare and hospitals in New York State during his time there. Once he joined Congress, the congressman was instrumental in passing legislation to support hospitals, emergency rooms, and their operations, trying to secure J-1 visas for healthcare workers from overseas that we desperately need, working to delay or to forestall 340B legislation that was impactful to us. Additionally, working on delaying the MCO tax that might impact New York State in a way that we would like to see it not. So very thankful for that as well. And then delaying the implementation of the ACA essential plan and its impact. So I'm very pleased to introduce Congressman Lawler. Thank him very much for his support over the years, and please tell us about your legislation.
Thanks, Mark. Well, thank you, Dr. Geller, and I want to thank Montefiore Nyack Hospital, its Board of Trustees, and I know we're joined today by Mark Jacobs, its chair, as well as Paul Adler, vice chair and the chair of the Montefiore Nyack Foundation. In addition to Dr. Geller, I want to thank Mark Mercurio, the CFO, as well as Michael Novak and Dr. M. I'm not even going to try to butcher that. As well as all of the staff and folks here at the hospital. I want to thank the hospital for the great work that they do in the community day in, day out. Montefiore Nyack has been a vital lifeline for so many in our community. It is, as a safety net hospital, serves a significant portion of Rockland County, but it is also a vital economic engine for the county and the largest employer. So I want to thank Dr. Geller and his team for all that they do. We're here today to announce and reintroduce the IVF Access and Affordability Act to make fertility treatments more affordable for American families. Fertility treatments like IVF can cost tens of thousands of dollars, and many insurance plans simply don't cover it. And I know how essential access to life-giving fertility treatments can be. For so many families, including my own, the road to having children can come with challenges that most people don't see on a day-to-day basis. Fertility care gives families hope, and it helps make the dream of parenthood possible. But for millions of Americans, the dream of becoming a parent is out of reach because of the cost and limited access to fertility care. According to the World Health Organization, about 1 in 6 people of reproductive age worldwide experience infertility in their lifetime. Here in the United States, the CDC estimates that nearly 20% of women of childbearing age face infertility. A Kaiser Family Foundation survey found that 1 in 3 women of reproductive age say it's challenging to access infertility services in their state. For those who have personally needed care, nearly half say it's difficult to get treatment where they live. That's simply unacceptable. And it's exactly why I'm reintroducing the IVF Access and Affordability Act. Here in the Hudson Valley, family is everything. It's the foundation of our neighborhoods, the reason our communities are so strong, and the heart of what we're all working to build. Every parent, child, and hopeful family deserves a chance to grow, to thrive, and to be supported along the way. And that's something I will always stand up for. The IVF Access and Affordability Act would provide up to $20,000 tax credit for individuals or $40,000 for couples to help offset the costs of fertility treatments. It's a common sense, bipartisan, pro-family policy that gives hope to those struggling to start or grow their families. Just last month, President Trump announced a series of historic actions to expand access to fertility care and lower costs for IVF medications. Under President Trump's leadership, the administration has taken major steps to make fertility care more affordable and accessible. New agreements with leading pharmaceutical manufacturers are reducing the cost of fertility drugs by as much as 80 to 90%, saving families up to $2,200 per IVF cycle. For the first time, these medications will also be manufactured here in the United States, strengthening our supply chain and lowering prices even further. The FDA is fast-tracking approval for new, lower-cost fertility drugs to bring them to patients faster, and employers now have a new option to offer fertility benefits directly to their employees, just like dental or vision coverage, expanding access for millions of families across the country. These are significant pro-family steps that build on what we've been working on in Congress. During the last Congress, I was proud to take bold bipartisan action to support families and to expand access to fertility care. I co-sponsored HRES 1037, which affirmed that in vitro fertilization is a necessary and life-giving option for women who cannot conceive naturally. I also helped introduce HR 9479, legislation to create a refundable tax credit to help families afford IVF treatments, recognizing that these costs should never be a reason that a family cannot afford to have a child. In addition, I was one of the first Republicans to co-sponsor then Congresswoman Susan Wild's Access to Family Building Act, which Congresswoman Laura Gillen recently introduced this Congress. This bill enshrines federal protections for IVF into law and ensures families have the freedom to make their own reproductive decisions. In the 118th, I also joined a bipartisan group of colleagues in introducing the Hope with Fertility Services Act, which requires private insurers to cover infertility treatments, a major step towards making care more affordable and accessible. My bill, the IVF Access and Affordability Act, builds on that progress by helping families overcome the financial barriers that stand between them and the dream of having a child. Together, these efforts reaffirm a simple truth. Supporting families means supporting every path people take to build them. So let me be clear. IVF and other fertility treatments are life-giving technologies. We should be doing everything we can to support families who want to bring children into this world, not making it harder. And I can tell you on a personal level, when my wife and I were starting to build our family, it was a very difficult process. And we suffered a miscarriage along the way. And in the process of trying to get pregnant, we went and saw a fertility specialist. And 3 days before we were to begin IUI treatments, we found out that we were pregnant with our daughter, Juliana. She's now 3.5 years old, and we have another daughter, Elizabeth, who is 1. But knowing that those treatments were available, that we had access to them, certainly put us at ease. And though we ultimately did not need to utilize them, I do think it put us in a position to ultimately have our daughters. And so we want to make sure that people have access to the treatment and the care that they need in order to build their families. So with that, I'd like to introduce Hani Sternberg, the president and CEO of Refuah Health, to deliver a few remarks. Mrs. Sternberg, thank you.
Thank you so much for this opportunity, Congressman. I just want to say I'm standing here representing hundreds of women who really should be here, who have struggled and continue to struggle and look for every opportunity, whatever, wherever, to be able to build the family, as Congressman said. The fact that IVF treatment will now become an opportunity, not just for those who can afford it, who are privileged, but for everyone, is a major milestone. I want to thank Congressman Lawler for your vision, for your heart, for being there for women, regardless of their ability to pay. Thank you so much.
Thank you, Mrs. Sternberg. I'd now like to welcome up one of our constituents, Rena Fox, to share her story as someone who has utilized these services. Rena?
Thank you, Congressman Lawler, for inviting me to speak on such an important topic. Everyone's IVF journey is unique, but I'd like to share a brief snapshot of mine. When my husband and I were dating, we discovered that we were both carriers of a genetic condition that would make having children naturally a serious risk. We knew that if we wanted to start a healthy family, IVF would be our only safe option. Once we began the process, however, we learned that things were even more complicated. We also faced unexpected fertility issues. Over time, we went through 4 rounds of egg retrievals, 1 failed embryo transfer, then a 5th egg retrieval, followed before welcoming our beautiful son into the world. Of course, every shot, every procedure, and every emotional high and low was worth it, but each step came with a heavy financial burden. Even though I was fortunate to have some insurance coverage through my job, we still spent tens of thousands of dollars out of pocket, and that was just to have our first child. We had always hoped for a larger family, but the cost alone made that dream feel uncertain. From a professional standpoint, both as an OBGYN and fertility nurse, I see the struggle every single day. I see hopeful parents forced to pause or even give up entirely on their dream of having a family because of financial burdens. IVF is an incredible scientific advancement, but it is not easy. The physical and emotional demands can be overwhelming: the daily medications, the procedures, the waiting, the disappointments. And when you add the financial strain on top of that, it can feel impossible. That's why Congressman's initiative is so meaningful. By helping to ease the financial burden of fertility care, this proposal gives more families the chance to experience the joy that comes with bringing a child into the world. This is not just about medicine or policy. It's about hope, fairness, and the future of families like mine. Thank you for giving me the opportunity to share my story and to lend my voice in support of a cause that truly changes lives.
Thank you, Rena, for sharing your story. And there, unfortunately, are so many folks across our community that have similar stories. And so being able to have access to these life-creating technologies is important. So thank you for being here. I now want to introduce Dr. Maria Emerson, Director of Obstetrics and Gynecology here at Montefiore Nyack Hospital, to share a few words.
Thank you so much. Good morning, everyone. This is an interesting setting for me. I'm neither political nor a media-driven person. However, when I was given the opportunity to say a small something regarding this goal, there was no way for me to say no. I have dedicated my life to women's health and their well-being. I hold several medical and leadership titles, but my favorite title is mom. And I believe that family is everything. The title of mom was my hardest and longest one to obtain, since my husband and I were affected with infertility for 13 years. I share this information only for background, since there is an understanding that comes from living a situation that is very different from reading it in the textbook. Infertility is ridden with anguish, guilt, and a feeling of not being able to accomplish the basics of what nature intended. It is heartbreaking, and it affects 10 to 20% of couples, no matter their economic situation or what their political affiliation may be. So what happens if infertility affects you? Once that diagnosis is made, we need to discuss treatment options. In the case of infertility, referral to a reproductive endocrinologist for IVF treatments and/or other assisted technology is the next step and the light of hope that our patients are provided. But IVF can be costly and it can be cost prohibitive for many couples, and this light of hope is often dimmed for those individuals. Protecting this service and making it accessible to our communities is worth fighting for. Family building is not a privilege that only a few should enjoy. My congratulations to Congressman Lawler on selecting a most worthy cause and standing behind it.
Thank you, Dr. Emerson. I'd now like to introduce the chair of the Montefiore Nyack Hospital Foundation, Paul Adler, to say a few words. Paul?
So, Congressman, I just want to make one correction. The most important title that I have is one that you left out, and that is that I am a grandfather of 5. The latest, as you know, just came 2 weeks ago. And that's from my daughter, who suffered, she and her husband suffered with the anguish of infertility. And the second child, she came to me, said, we're planning a family. And again, unaffordable, unachievable. And luckily, but it shouldn't be the case, Mary and I were in a position to be able to help her with the IVF treatments. And she came again for the second one. And as happened with you, by the time she got her appointment for the second infertility treatment consultation, she went and received the great news that she was pregnant. So that is not the way it should be, that either families can't begin because of the cost, or they have to worry or try to find somebody that can help out with this critical moment in the life of a family. So we are very grateful here at the Montefiore Nyack Hospital for this. This is about families. It is so critically important that this very basic right is covered, and the Montefiore Nyack Hospital Board of Trustees and, of course, the foundation stand behind you in this effort to improve the quality of life, for putting families first in our region and now throughout the country, to make certain that this kind of legislation is passed. And I can tell you that if you are able to pass this and get it signed into law, this will be a mitzvah indeed, a good deed that will happen here. And we are grateful to you for using the Montefiore Nyack Hospital as the backdrop for this most important healthcare announcement. So we thank you, Congressman Lawler.
Thank you. Well, thank you, Paul. And again, I think this is a great bipartisan effort to ensure that IVF treatments are accessible and affordable. And from my vantage point, there is a lot that we can do in Congress and in Washington to make sure that that is the case for millions of Americans across the country, and why I've been proud to lead on this issue to ensure that IVF treatments are enshrined into law, that insurance companies are required to help pay for them, and that Americans are able to receive a tax credit to help afford it. That is vital, and the work that is being done as well to ensure that the necessary drugs are affordable is critical too. So we will continue to lead on this and to fight to get this across the finish line this Congress. And again, I want to thank Montefiore Nyack for hosting us here today and for all those in support of this legislation.